National Institute for Mental Health and Centers for Disease Control, 1.9 million children ages 3 to 17 are diagnosed with depression, and 17.3 million American adults suffer from depression in a given year. Depression and helping others with depression is something I have learned a lot about from various psychology classes. It is a growing problem in today's society, so many of you probably know someone who has suffered from depression, or possibly even you have struggled with these feelings. Today I hope you are able to get a deeper understanding of depression and how it may present itself and what ideologies and processes help. Depression is a complex disorder with many causes. According to the Mayo Clinic, the first cause and most commonly accepted cause is a chemical imbalance in the brain. Neurotransmitters are chemical messages your body's nerves use to communicate. There are three main neurotransmitters related to depression. These are serotonin, norepinephrine, and dopamine. Serotonin is known as the happy chemical. Low levels of this happy chemical affect mood in a negative way, leading to negative, depressed feelings and actions. Norepinephrine is related to energy, specifically energy during times of stress. Without a balanced level of norepinephrine, someone will feel unmotivated or overwhelmed by small amounts of stress. Similarly, low levels of dopamine can also cause the unmotivated feelings of depression. Inherited traits are also a cause of depression. This cause is still being researched, but it is apparent that if a relative has experienced depression, then you are more likely to experience depression. Currently, researchers are trying to determine if there is a gene that predisposes people to depression. Changes in hormones may also cause symptoms related to depression. This is evident in teenagers going through puberty and new mothers who experience postpartum depression. Additionally, personality can also predispose someone to depression. If someone struggles to cope with stress, change, or other situations, they might be more susceptible to depressive feelings. A chemical imbalance in the brain, along with additional causes, will cause many physical and emotional changes. Depression has many serious symptoms. To be diagnosed with depression, a person must experience 5 or more of the DSM-5 criteria in the 2-week period. The criteria includes depressed almost all day, every day, noticeably diminished interest in activities, people, etc., an abnormal sleep schedule nearly every night, psychomotor agitation, which is unusual, purposeless movement, significant weight change, fatigue, feelings of worthlessness or unnecessary misplaced guilt, an inability to think, focus, or make decisions, or recurrent thoughts of death and suicide. Everyone who experiences depression experiences it differently. It will appear differently in young children, teenagers, and young adults, but all must meet 5 of the previously stated criteria. Depression is an ongoing battle that requires some form of treatment. Depending on the person and the severity, depression has a multitude of treatments. The first treatment option is therapy. Psychotherapy is the most common therapy in treating depression. The goal of psychotherapy is to teach specific coping mechanisms and other ideologies. These include adjusting to crisis and difficulty, identifying negative behaviors and replacing them with positive interactions, regaining a sense of worth and satisfaction, setting realistic life goals, and being able to tolerate and accept distress and negativity. Using healthy behaviors. Other therapies like online sessions and phone calls are also used, but face-to-face psychotherapy is seen as the most effective. Medication is also effective in helping those who suffer from depression. Usually a doctor will prescribe an antidepressant. Antidepressants are created to manipulate chemicals in your brain, like the neurotransmitters we talked about earlier. There are 5 main types of antidepressants: selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, atypical antidepressants, tricyclic antidepressants, and monoamine oxidase inhibitors. All of these affect different neurotransmitters in your body. The antidepressants that affect more than one chemical are typically viewed as stronger and as having more adverse side effects. The side effects can be severe and at times dangerous, or they could worsen the symptoms. Additionally, medications can also be almost impossible to stop taking, so medicine, especially strong medications, are usually seen as a last resort treatment. Both therapy and medication are the best options when the depressive disorder is severe. The medication will limit the current risk and harsh symptoms, while the therapy helps prepare the patient for the future. Today we have discussed the causes, symptoms, and treatment options for depression. Depression is a complex mental disorder that affects many people differently. Therefore, there are many different causes, symptoms, and treatment options. Understanding depression and all of its complexities encourages people to be more sympathetic when encountering depression. If you know someone who might be struggling with depression, encourage them to reach out and get help, and give them patience and support while they work towards feeling better. Thank you.